Hey everyone, my name is Jack. Welcome back to the channel. I cover a variety of topics as they relate to real estate, investing, the markets, and pretty much everything as it relates to personal finance. So if you like that sort of content, be sure to have a look around the channel, and if you like what you see, be sure to subscribe. But the other day I came across an article talking about the future of healthcare and real estate, but not real estate healthcare investment, but rather actually providing healthcare as an amenity. That is, there are an increasing number of commercial real estate landlords that are actually offering landlord-subsidized health insurance and telemedicine benefits to their tenants. It seems like this has just been limited to office and retail tenants, those who have a lot of employees, where they would normally be spending on it themselves to get employer-sponsored insurance programs. Instead, they can actually go to their landlord, who will offer a similar type of service, and maybe it'll be cheaper than the company trying to get it themselves. And some landlords and care providers apparently can go as far as including little clinics inside the building so that employees or people using the building can quickly get checkups, which is very relevant in a pandemic era like we're in right now. And this sort of amenity really works to fill a need, and that need is not only providing affordable healthcare to tenants and individuals thereafter, but also to try and keep workers and the spaces that they're in safe, to make sure that people who are sick or who appear sick aren't going into the workplace or going into that building that's being managed by this landlord that offers this service. And it seems like a great way to actually keep things operating, which, while it might seem more expensive for the landlord up front, you at least avoid vacancy or having tenants who have no way of operating because of health concerns. This can at least mitigate some of those health concerns because you have the service available to tenants. But when I read this article, I was thinking, I wonder if you could extend this to residential landlords who would then provide health insurance or some sort of service to their tenants. This might be a little bit difficult on a small scale, but for something like a 200 or 300 unit complex, I would feel like a landlord could probably get a pretty substantial bulk discount on insurance and could then pass that on to tenants if that makes sense in an area. And long term, I think this is going to become increasingly desirable, not only, like I said, with getting affordable healthcare to more people, but also with trying to keep spaces clean and healthy and making sure that people aren't getting each other sick, since that can lead to a lot of bad things, as we've seen firsthand. I could see it potentially getting complicated, at least at scale, when you have lots of vacancy and you're trying to bring in new tenants and put them on new plans, and that could get pretty complicated. But then again, large corporations do that all the time with thousands of employees, so I don't see it as much of an extension to see a landlord potentially doing that as well. And then basically the landlord would treat it like an amenity, and it would be bumped onto rent in some way, maybe as a fee of some sort, a healthcare fee on top of your rent, and then your tenant has healthcare, which I think could be really, really advantageous for someone who might not work at a large corporation that offers really good healthcare, and maybe they're a 1099 contractor and they have to provide their own healthcare anyways, and this could be a cheaper alternative. There's definitely a large need for providing affordable health insurance. As the whole Obama era showed us, there's clearly a demand for affordable care. And unfortunately, a lot of the policies that have been passed have been relatively ineffective, at least at scale, for trying to keep things affordable. They have provided healthcare to those in the most need, but on the aggregate, I would see something like this as being a really good sort of midway solution for providing healthcare to those people who might not get it through work and who might not get it through the government either, or want some alternative. And on the flip side, health insurers would have a huge opportunity here given the increased demand for quality healthcare given this pandemic, and they could start proactively shopping for properties, basically, where they'd go to landlords and property managers and offer this package saying, hey, if you agree to advertise this insurance policy to all of your residents, we'll give you a bulk discount of some sort, and then you can pass it on to residents, something like that. Now, I'm not sure about the legal consequences of something like this, since I'm not sure who would be ultimately on the hook for the policy. I'd assume you'd keep it on the landlord, and then the landlord passes it through as an expense to everyone else. I don't know how that would work exactly, but it seems like it's a feasible idea since it's already being done on the commercial side. And I think this could be a great alternative for a lot of older buildings that might not have a lot of great new amenities and new build outs, and they can instead offer this healthcare package to their tenants as a way to entice them to stay, or maybe have it tied to signing up for a long-term lease, as in if you sign up for a 2-year lease, then you get this reduced cost healthcare plan through the building. There's all sorts of ways that a landlord could use this to their advantage and also provide a service to a tenant, and this should be a win-win as well, since tenants would be provided with healthcare from their landlord, and then they'd always be covered, and it would be at a cheaper rate than they might be able to do otherwise if they were just shopping individually. Really, it's just taking the same principle that an employer would use and applying it to a landlord with many tenants. The rise of things like telemedicine have definitely lowered the cost of basic healthcare services, so it doesn't seem like that much of a stretch that a landlord would be able to provide them without bumping rents too much, especially if there's a discount program through a healthcare provider that could actually provide this at scale to many tenants and provide a discount to that landlord. And then a tenant could upgrade to a more advanced package if that's what they happen to want, and just like an employer would, where you get to elect usually between some sort of basic care, a family care, or some sort of high quality extra care, depending on your insurance needs. I don't know where this is going to go long term, but it seems like it's leaning towards being more likely than not, just given the current situation with healthcare, and given that this seems like a pretty, I don't want to say seamless, but definitely practical alternative to the current system. Anyways, that's all I've got for today. I just wanted to share that idea with you guys after reading about a very similar concept on the commercial side, just thinking maybe it could be extended to the residential side as well, providing healthcare to tenants as well. Definitely would love to get your guys' thoughts in the comments below, but if you like this video, be sure to give it a like since it helps the channel out a lot, and check out the links in the description for free stocks with Webull and Robinhood and all that good stuff. My affiliate links are waiting for you, and your free money is waiting for you too. But until next time, take care.